Hello, doctors, and welcome to our session for today. The session today is a practical mock. We are going to discuss two SIMMAN cases. They are related to each other, all right? I'm going to do four SIMMAN, okay, with 4 doctors. What will happen is that the first 2 doctors will do the same case, and the second 2 doctors will do the same case. This will allow you to find out your mistakes and to learn from both of the doctors, the mistakes of both of the doctors in the same case, and will allow you to to enhance your knowledge in these 2 specific cases. Okay? Happy with this?
Yeah, thank you, doctor.
Yeah, that's fine.
I'm agree with that. Okay.
Okay, good, good. All right. Well, yeah. Who wants to start?
I can start if you want.
Who is talking?
Malaria.
Valeria. Okay. All right. Well, I'm going to share the question now. Okay, you will have
Just
1.5 minutes.
Give me a second, yeah.
Yes.
Yeah.
What I need from all of you doctors, please, if you can switch your camera on, yeah?
Yeah.
And prepare any pillow or doll or anything in front of you. Cover it with a blanket, and if you have a stethoscope, it would be good. In addition to that,
I have.
if you don't have a stethoscope, it's fine, but it's better to have a stethoscope with you.
I have a doll and a stethoscope.
Sorry?
I have a doll and a stethoscope as well.
Okay, good. All right. And what else? If you have any, notebook, just put it beside the doll, and that's it. I just want to assess you. How are you going to deal with the patient? Are you going to check the notes of the patient? Are you going to examine the patient in the right way? With the right steps? All of this I'm going to assess during the case. All right. You are muted, Dr. Valeria.
Yeah, can you see me?
Yes, I can see you, and I
Okay.
can hear you as well.
Is it the front camera working?
I can see you.
Okay, amazing.
Okay, good.
Yeah, I have a doll here.
Yes, I'm going to share this. Yeah, good. Okay.
Nice. Excellent.
I'm going to share the question now. You will have 1.5 minutes to read your question.
Okay.
And once you start the station, I'm going to share the screen, the monitor, to see the monitor while you are dealing with the SIMMAN. When you are listening to the chest, I'm going to play small video to show you what are you going to hear while you're listening. Okay?
Mm-hmm.
All right.
Yeah, amazing.
Okay. I'm going to mute all of the doctors, and please, Dr. Valeria, unmute yourself. Okay?
I'm unmuted, yeah.
Yes. So unmute yourself. Unmuted all because there was some noises. Yes. So starting the 1.5 minutes from now, and please read your question.
Begin.
Off you go.
Hello, my name is Valeria Makaran from one of the junior doctors working here. May I confirm your name, please, and your age?
Doctor, I'm Maria Thompson, and I'm 78 years old, doctor.
Okay, nice to meet you, Maria. I can see that you're feeling not really well. Is it okay if I'll do a quick assessment and we'll figure out what is going on?
Yes, doctor. Yes, I'm feeling unwell. Yeah.
Okay, I can see that Maria, I can see that you can talk to me, meaning that your airways are patent. So, are you difficult to breathe? Yeah, your oxygen level is a bit on the lower side, so I'm going to give you some oxygen, one non-rebreather mask, 15 liters.
Okay.
Take a deep breath in, out, and you're going to feel better soon. Okay?
Okay,
Just
doctor.
to breathe. Okay, good. So Maria, next I'm going to check your breathing. I'm going to check your skin color.
Okay, normal skin color.
Okay, Maria, I'm going to press on your windpipe. It might be a bit discomfortable, very important to do.
Okay, central.
Okay, Maria, I'm going to put my arms on your chest to check your breathing, okay? I'm going
Okay.
to
Normal muscle, respiratory muscle movement.
Okay, Maria, I'm going to tap on your chest to check your lungs. Is that okay?
Assume it's normal, doctor.
Normal. Okay, Maria, next I'm going to listen to your lungs. Is it okay with you?
Yes.
Sorry, my one.
Uh,
Can I see my
yeah.
patient's heads? Oh, okay. Mhm. Okay. So I can appreciate crepitation in the lung fields. Crepitus.
Okay.
Okay. Can I check my patient's vitals, please?
What do you want to see, doctor?
I would like to assess her saturation level after giving her oxygen. Or Maria, your saturation a bit improved. Your oxygen level is rising, so this is a very good sign. Okay, your blood pressure is all right, and heart rate. I'm happy with your heart rate at this point. So next, I'm going to check your circulation, check your heart, your pulses, if that's okay with you.
Okay.
So, Maria, I'm going to have a feel of your hands. Are they clammy, moist, cold, or warm?
No. And
Nothing
the
like
cap
that?
refill is 2
A
seconds.
capillary refill. 2 seconds. Thank you. Maria, I'm going to check your pulses, your radial pulse.
Normal bilaterally.
Normal. Maria, can you look in the corner of the room? So I'm going to check the special pulse in your neck.
Okay. Assume it's normal, darling.
Assume it's normal. Okay. So I'm going to check for central cyanosis. Nothing like that, Maria. I'm going to
No
listen to your
cyanosis.
hearts. Okay, I'm going to listen to your heart sounds.
Okay. Just listen.
Okay. Normal heart sounds.
Okay.
Maria, so as you're feeling not really well, I'm going to put 2 white ball cannulas in both of your arms, if that's okay with you. From
Okay.
the one, I'm going to take some blood. It's very important to investigate and exclude some conditions. So I'm going to take full blood count using this CRP. I forgot to check your temperature, Maria. How are you feeling?
38 the temperature.
Okay, Maria, I'm going to take some special blood test to exclude any infection in your body. So I'm going to take full blood count using CRP blood cultures. Also, I'm going to take VBGs to it's a special test to check how you're doing. And this is
Okay.
it for now. And
Okay.
I'm happy with your blood pressure. You're feeling. How are you feeling?
Much better, doctor. A little bit better. Yeah.
Okay, Maria, also I'm going to put a urinary catheter to check your urine output, if that's okay. It's very important to monitor the fluids. Can I reassess my patient's vitals?
Okay.
Okay, I'm happy with your blood pressure, Maria, but I'm quite concerned about your temperature, so I'm going to give you some paracetamol intravenously, if that's okay.
Okay.
So I'm going to move to disability. So I'm going to check my patient AVPU scale. Maria, how are you?
Okay, doctor.
Okay, my patient is alert.
Yeah.
I'm going to check her pupils. Maria, I'm going to put some light in your eyes.
Bilaterally reactive.
Okay, I'm going to check your blood glucose.
4 millimole.
4. Okay, and also I'm going to have a look at your drug chart. It's very important to see what medication I'm receiving.
The drug chart is here. The notes of the patient. She's taking nitrofurantoin.
I see. Okay, thank you. So Maria, and it's very important to have a look from you from head to toe. Is it okay if I expose you and
Okay,
check your?
doctor.
I'm going to expose my patient. So Maria, I cannot see any bleedings, rashes,
2
or
minutes remaining.
Yeah.
injuries in you.
Yeah, assume the exposure is normal.
Okay, Maria, thank you for letting me do this. So from my assessment, I assume you're septic because of your recent urinary tract infection. So
What do
I'm
you
going
mean?
to sepsis is the generalized infection in your body. So you had your infection and it spread to your blood.
Oh my God.
This is why you're having this high fever and you're feeling quite poorly.
Is it serious, doctor?
This is quite serious, yeah, Marie. So, but you're in safe hands. So we are a team of very experienced doctors, and we are going to help you. Is that okay?
Okay.
Okay. So I've already given you some oxygen, and I've given you I've taken some blood tests, and I've checked your urine output. So next we are going to start your antibiotics. Is it okay?
Okay, doctor.
Okay, Maria. So you're going to feel a bit better soon. So we are going to do some blood tests for you and find out what exactly is going on. How does it
Okay,
sound?
Okay, all right.
Okay, Maria. Yeah, take it. You're in safe hands. So a team of nurses are always around, and if you feel a bit more, if you start to feeling worse, please let us know. Okay.
Okay, doctor.
Okay. This completes my assessment.
Okay. Thank you. Thank you, Dr. Valeria.
Yeah.
All right. So you still have time, which is
Okay.
good. Yeah. I'm going to stop the timer and let's talk about your performance. How do you feel first?
I'm a bit. I think I'm okay, but I'm still didn't get it. How should we talk to the patient and examine and talk to the patient, asking the findings from the examiner, and I'm still a bit confused about this.
Mm-hmm. Yeah.
Yeah.
Hopefully,
So,
after we talk, you will have a clear idea about how to deal. This is
yes.
okay. This is your concern. What else?
How should we represent the management? Because patient is patient and maybe not very familiar with all the medical terms which we are going to tell about them in terms of management.
Okay.
And another concern and a question at which point of the ABCD protocol we should initiate the management in PLAB 2, because it is a bit different to ASCII's. This is my question, yeah, basically.
Okay. All right. So you have two questions. The first one, how to deal with the patient. I mean, can you remind me with the question?
The question, how should we verbalize what we are going to look at the
Yes.
patient, and
Yes. In
how
terms of
should
speaking
we
to the
how
patient
should
and
we
the
manage
examiner.
between the
Yes. Between
how
the
to
patient.
communicate it correctly?
Yes. Between the patient and the examiner. The second one is when you start the management.
Yes,
Okay.
correct.
All right. Okay. I'm going to answer these questions while I'm giving my comment. There is a question for me now. I want to ask, if you don't mind. Do you think this condition in this patient is sepsis?
Oh, it is not sepsis because your blood pressure is okay. Yes.
Not only the blood pressure. We are going now to talk about sepsis and how to differentiate between sepsis and infection, and what are the criteria of sepsis, and when to say or to diagnose or to suspect sepsis. Okay?
You
All
just
right.
had okay.
Okay. All right. So in this case, in this particular case, it is not.
It was just pneumonia. It was just pneumonia.
Yes.
It was just pneumonia from the hospital. Okay.
Yes. Hospital acquired
It's
pneumonia.
pneumonia.
Yeah. And why it is hospital acquired pneumonia?
Because she acquired it after the admission to the hospital.
Yeah, the patient was in the hospital for 3 days, and we suspect
Yeah.
or we diagnose hospital-acquired pneumonia if the patient is within 48 hours and above in the hospital. Yeah,
Sure. Mm-hmm.
okay, all right. Okay, so this is my question. So let's agree that this case is not sepsis. Yeah.
Not
How to
sepsis.
diagnose sepsis and how to find out is it sepsis or not? We are going to discuss that shortly. I'm going to comment on your performance from the start till the end. Yeah, what you have done, what are your mistakes, and how to improve them. And also, I'm going to answer the 2 questions. Yeah. Okay. Firstly, you started by confirming the patient's identity, and you tried to comfort the patient, and then you started your assessment. Your introduction to yourself and checking the patient identity was okay and good. The start of the station was really, really good. But I would love if you just took some data gathering from the patient.
Mm-hmm.
Okay,
Sure.
you jumped to take the assessment right away, ABCD assessment, okay, without checking what does she mean by unwell, feeling unwell. Is it feeling sick or lethargic or didn't pass urine or whatever, short of breath, whatever
This is the difference, I suppose.
does she mean by feeling unwell? Okay, and since when you've been feeling unwell? All right, you can ask her, what happened? Can you tell me what happened exactly? Since when you have this? All right, is it getting worse? Quickly, all right? 2 questions. What happened since when you have this? Any specific thing happened before having this? Okay, all right. This is the first thing. Then after that, you ask the patient, any allergies, any medications or medical conditions? All right? From my perspectives, I put a specific mnemonic for Simman. This mnemonic is WABAM. WABAM. W is for what happened. Okay. B is did that happen before? But here, the patient is in the hospital. It's unlogic to ask him, did that happen before? All right. A is for allergies. M for medical conditions and medications. All right. Okay. Let me share the. Just give me a second. I will share the Simman structure quickly just to be quicker in assessment.
Yeah, we see.
See this? Okay. You've done this, but you didn't do this. Okay. Explore what happened. Any specific thing happened. Then did that happen before? It's not logic here. Any allergies, any medical conditions and medications. Then you start your ABCD assessment. Okay.
Okay.
Started your ABCD assessment. I was happy with your ABCD assessment. The ABCD E was, systematic in terms of the assessment. Inspect, palpate, percuss, auscultate in breathing, in circulation, heart sound, blood pressure, pulse, cap, refill. No need for external signs of bleeding. The blood pressure is okay. Then in D, you've done all of these, AVPU, glucose, pupil, and drug chart. And in E, you check the temperature and examine the tummy and the leg. Okay? All right, you've done all of that. I would love if you, once you find something wrong, to investigate on the go and treat right away. Okay? So you treated without investigating. There was a crackle in the chest, right?
Yes.
Ask for ABG and chest X-ray right away. Okay? ABG and chest X-ray. Then you give the treatment. The treatment is oxygen here. Okay? All right? Then in C, you assessed the C and then you put cannula and you've taken the bloods. Okay? I was happy with taking the bloods in terms of full blood count, CRP, SR, everything was good. Okay? You didn't ask for ECG. Always ask for ECG in circulation, especially if you missed it here, it's not a big problem, okay? But if something related to the heart, you will have to ask.
Yes, sure.
Yeah. No need for giving fluids to the patient. The blood pressure is okay. All right. And no need for inserting a catheter.
No need, yeah.
Yeah. Okay. You are not going to give fluids to the patient, so you don't
Sure.
need to insert a catheter. Okay. In D, the D assessment was okay. You didn't do anything wrong. Nothing to investigate, nothing to give. In exposure, you checked the temperature in circulation, which was okay, not a very big problem, and you gave me paracetamol right away, right? Okay. Then you told me sepsis.
Which was wrong.
Okay.
Mm-hmm.
The patient vitals are okay.
Yes.
No tachycardia.
I don't know. I was just a bit.
No tachypnea. No anything. No nothing. Okay.
I
It's
agree.
just crackles and high temperature.
Mm-hmm.
Okay. So this is hospital acquired pneumonia. All right. The diagnosis was wrong. Yeah. Management. In the management, you check the patient if he has any concern. Do you have any concerns? After explanation of the diagnosis, then you tell the patient, all right, we are going to keep monitoring you because he's admitted already. Okay. We are going to keep monitoring you. Okay. We will take blood culture if you didn't mention. Okay. Urine as well. Again, maybe it's super added infection. All right. If you didn't mention the X-ray from the start, ask for X-ray. So you tell him, we are going to monitor you or keep monitoring you. We'll ask for some investigations like chest X-ray, blood culture, and sputum and urine culture as well. Okay. And we will start you on antibiotic through your vein to treat this infection. And that's it. This is the treatment. Okay.
Yeah.
All right. So this is what you missed and what should be done. In terms of your question, how to deal with the patient and the examiner, when you talk to the patient, you talk in simple way. All right. Simple language. Okay. I'm going to tap on your chest. I'm going to take some bloods or throw some bloods from you to check the function of the organs in your body. And then you look at the examiner. You ask, I need or I will order CPR, ESR, CRP, ESR, and whatever the bloods that you want. Okay. Yeah. If you don't want to look at the examiner, it's fine. Just talk to the patient and then raise your hand, just like you're gazing to upwards to to talk with the examiner. Okay. All right. This is how to deal in talking with the patient and talking with the examiner. Did I answer this question?
Yes. Thank you.
The next question is when to start the management. Well, in the SIMMAN, the management is as you go. Okay. In A, if you find something wrong, you treat, you investigate and treat. Breathing, investigate and treat. C, investigate and treat, okay? And then you give the diagnosis and you talk about the management, the further management. You start from the next step. What you didn't mention here, you will mention here in the management.
Mhm.
Okay?
Yeah.
Got it?
Got it.
All right. Okay. Did I answer all of the questions?
Yeah, thank you so much. Thank you.
Okay. Good. All right. So if I want to give you marks, where are the marks? Yeah, here. Yeah. Data gathering. You didn't take history from the patient.
I
Okay.
didn't know that we need to do this in PLAB. Yeah.
Yeah. You don't
Mhm.
need to take, too much history. All right.
Just
It's
ask what
just
happened.
four questions. What happened? Any allergies, any medical condition, and that's it. Okay. All right. And in what happened, when you ask what happened, you have to put an aim in your mind. Why you are asking about what happened? What is your aim in this? To find out what is the professional diagnosis. Okay. You
Mhm.
ask what happened since when you have it. Any specific thing happened before it. Okay.
Mhm.
All right. And in any specific thing, if you find or if you think about a specific cause, ask about the cause. All right.
Mhm. Mhm.
Got me?
Got it.
Okay. I would say in data gathering too. Management skills, sorry for this.
That's all right.
Sorry. Okay. Interpersonal skills. I would say 3, we're trying to calm the patient, but I would love if you just, when you talk about medical jargons, just don't talk to the patient. Talk to the examiner, okay? But in general, interpersonal skills, okay.
Okay.
All right.
Thank you.
All right. Thank you, Dr. Valeria. All the best. And yeah, hopefully we hear very
you.
good news about your exam, inshallah. Okay, let's do the next case. Who is the next one? Dr. Umayma?
Hello, yes.
Dr. Umayma,
Yes.
ready?
Oh, not really.
Begin.
Start.
Hello. My name is Samama, and I'm one of the doctors in the medicine department. Are you Mrs. Maria Thompson?
No.
Um,
Yeah.
Can you please confirm your age for me?
Yeah. I don't know, doctor.
I'm sorry.
I don't know.
So, could you tell me what's wrong?
I don't know. What's going on?
So I can see that my patient is a bit confused. Mrs. Thompson, do you know where you are?
I don't know, doctor.
Okay, so I can see that my patient is confused.
Oh,
I'd like to see the monitor, as if she's attached to the monitor. Okay, I can see that her saturation is low. I'd just like to quickly check her airway.
airway is patent.
I'll just attach an oxygen mask, an NRM, with oxygen 15 liters per minute.
Okay.
Mrs. Thompson.
Yeah.
How do you feel right now?
I want my sister.
She's still confused. Okay. So, Ms. Thompson, I'm just going to quickly examine. I'm going to start my ABC protocol. Okay.
Okay.
I may need to expose some parts of your body, and I might need to touch them as well. I'll have a chaperone present with me, and ensure
Okay.
privacy. All right. So I just quickly check the airway. The trachea is central.
Central.
I'm going to. Can you take a deep breath for me? Okay. I'm going to tap on your chest.
Assume it's normal.
I'm going to quickly listen to your heart sounds. Sorry, lung sounds and your heart. So there are, I can appreciate some added sounds. I'm going to have a look at the monitor again. Okay, I can see that the saturation is a bit better. I'm going to send for an X-ray and some ABG. And then
Okay.
check for the circulation. So I'm just going to check your pulses and your capillary refill time in the meanwhile. The blood
Okay.
pressure seems fine. I'm going to add 2 large bore cannulas. You'll feel a bit of a scratch. So cannulas.
Okay.
I'm going to take some blood and send to labs, some basic labs. We should be sending the CBC, UNE, LFTs, RFTs, and some inflammatory markers, CRP, ESR, and some blood cultures.
Okay.
And I'd like to do an ECG as well. Maria, Mrs. Thompson, I'm just going to check a shine a light in your eyes
Normal, bilaterally reactive.
and check for your blood sugars. You might feel a pinch.
4 millimole.
And I'm going to check your temperature.
38.
Okay, so your temperature is a bit it's a bit increased. I'm going to give you some paracetamol. Okay. And I'm going to have a look at your abdomen and your legs to see if there's anything.
What are you looking for, doctor?
Well, edema, any rash.
No edema, no rash.
Okay. And okay. So, Mrs. Thompson, are you able to
Yeah.
hear? How are you
Yeah.
feeling?
I'm okay.
Could you tell me since when you've been feeling this way?
I want my sister.
Okay, so I can see this. We may need to. Oh, yeah, I need to check her drug chart to see.
Okay. This is the drug chart. The notes. She's taking nitrofurantoin. The last dose was 2 hours ago.
Okay, so I'll just quickly check the catheter side to see if she has any catheter.
She doesn't have catheter.
Okay, so I would also like to request urine cultures along with the blood cultures, and we may need to update your antibiotic regime.
Type of antibiotic?
Sorry,
What kind of antibiotic?
a broad spectrum, something like piptase.
Okay. Doctor, what do I have, doctor?
So
Where's my
2
sister?
minutes remaining.
Mrs. Maria, I believe that you were admitted with a UTI infection, an infection in your urine, right? And I assume that it has increased, or it is possible to have it for another infection in the chest. For that, we have sent some tests again to see how you're doing. And if you are able to cough up some sputum, we would also like to send some sputum cultures. In the meanwhile, we've added some antibiotics, which will help bring down the infection, and you've been given some pain.
Okay, can you talk with me, doctor? So
Yeah.
what's going on with this patient?
I believe that Mrs. Maria Thompson, 78, was admitted with a UTI. She was initially started on nitrofurantoin. She was not feeling well, so when I came here, I assessed her. Her saturations were low. The blood pressure and heart rate and the respiratory rate was the blood pressure, heart rate was fine, but the respiratory rate was also a bit elevated. So I gave her.
Okay, what do you think that she has?
She has a probably a pneumonia from being in the hospital. And I
Okay,
believe that she would do better if we are able to give her some antibiotics for that.
okay,
Escalate the antibiotics that she's on at the moment. She's on nitrofurantoin, so we should give her some broad spectrum ones and wait for the culture results. A test.
all right. Okay, can you tell me again what is the type of the antibiotic?
Broad spectrum antibiotic, Piptaz,
Okay.
and piperacillin tazobactam.
Piperacillin?
Tazobactam or meropenem.
Okay, all right. Okay,
Move on
Thank
to the
you.
next station.
thank you, Dr. Umaima. Thank you so much for your participation. How do you feel?
I think I messed up.
Can you raise or can you speak up a bit because I can't hear you?
Yeah, I was saying that I think I messed up. So I think I messed up a few steps, and I was very nervous. So
Why do you think that you messed up?
Begin.
Few things or
because I think I'm not sure though. I think in the beginning is there supposed to be a bit of a history, like you said, but obviously the patient wasn't able to, so I switched it around.
Yes, the patient was confused and you asked her about where you are.
Yeah.
You could have asked her, do you know where you are? Who do you know who am I? Okay, what is the day to day? 2 questions and that's it. But she was confused. She was telling you, where is my sister? Where am I? So she was confused. You can't take us, a proper history from the patient.
Yeah.
Okay, what else?
The other thing I feel like is that I keep repeating in the management, especially, I keep repeating things without really thinking about it in the way that the patient might understand.
Okay.
I'm a bit worried about there being medical jargon, and
It
I
was
tried to
not,
follow that.
it was
I
not
tried.
really medical jargon. You didn't use too much medical jargons.
Okay,
Okay.
and yeah, I think that was what I was worried about. I did try to like stick to the A B C D E.
Okay.
I may sometimes like flip it around, like the D part and the E part, because I really want to finish the station.
Mhm.
I did try to like stick to it.
Okay. All right. Okay. Thank you for your comment. So, do you know if you just practice one thing, Dr. Umaima, your performance will be perfect.
Okay,
What is it?
I'm not really sure.
Confidence.
Okay,
All right. Your
yeah,
voice was very, very low. You were
okay,
showing that you're a bit scared, not anxious, scared. You're scared to talk, okay? Despite that you were very, very systematic,
okay,
okay? You were very systematic in terms of the taking the history, A, B, C, D assessment, investigate and treat as you go, giving the right diagnosis. Everything was good, okay?
okay,
But confidence, talk loudly, be confident in your steps, don't be scared.
Okay.
All right? Please practice on this. All right? You have a very good systematic approach.
Okay.
Trust yourself and move on. Okay? All right? Okay. So, you took the history from the patient. The patient was confused. You asked her, where do you know where you are? Do you know who am I? Or whatever the question that you ask, just to check if the patient is confused or not. The patient is confused. I would love if you just ask for the notes from the start, just to check if the patient has allergies or any medical conditions from the start of the case, especially the patient is confused. You can't take any history from the patient. All right?
Yeah.
Okay. So your data gathering either will be from the patient herself or himself. If you can't take the history from the patient, you have notes. Okay? Ask for the notes from the start. Yeah. Where is the yeah, it's here. Okay. So ask for the notes from the start if the patient is confused. Yeah. Then you do your ABCD assessment. You took a permission from me to examine. You've taken A and B and C and D assessment. Really good. You asked for ABG and chest X-ray. You gave me oxygen. You inserted a cannula. And you've taken the bloods. You've given to me paracetamol, I think. Yeah, paracetamol in E, or once you find high temperature. What is the first line of treatment in terms of hospital-acquired pneumonia?
Should be clarithromycin.
Coamoxiclav.
Okay.
Okay, coamoxiclav is the first line in treatment of pneumonia. What if the patient is allergic to coamoxiclav? You can start clarithromycin or anything else which is not, or doxycycline, based on the allergic status of the patient. Okay?
Okay.
All right. So please, here, allergy is important from the start. Okay? Then you told the patient that it is infection in the chest, and you told me, what are you going to do? I was confused. You talked with the examiner. When you talked with the examiner, you've given the background of the patient and your assessment. You used this ISPAR way, okay, properly. So I'm happy with the ISPAR that you used. But the only 2 points that I would like to comment on are the confidence, yeah, and allergies, please, and patient's notes from the start if you can't take any history. This is part of your data gathering. Okay?
Okay.
All right. Thank you, Dr. Umayma. If I would
Thank you, Dr. Saad.
talk about the marks, data gathering, I would give you 3 in data gathering, okay? Because of the patient didn't have any allergies, okay, you were safe.
Yeah, I get that, yeah.
But if the patient has allergy for something, you will be in a risk of losing the case. Okay?
Yeah.
Okay.
Yes.
So notes, please, doctors, all of you. If you can't take a history from the patient, take the notes from the crash trolley, or ask the examiner for the notes. Yeah. Management skills. 3. Interpersonal skills. Well, I will give you 1 just to encourage you. For being,
Yeah. Okay.
okay. Yeah.
Yeah.
All
Yeah.
right. Okay. We didn't talk about the sepsis criteria. So sepsis criteria are, and before I talk about it, what is the difference between sepsis and septicemia? What is the difference between sepsis and septicemia? Are they the same terms? Both of them are with synonyms, or they are different?
I think sepsis, in order to call a condition sepsis, doctor, it has to meet certain criteria. But
Okay, all right. And
septicemia is just
septicemia?
a state. Yeah.
Septicemia, as Dr. Noor said, septicemia is an infection of the blood. Yes, septicemia is an infection of the blood. All right. The bacteria or the virus or whatever the infection is spread to the blood. But sepsis means
Involves the
organ affection. Okay, the infection and the problem reached the organs. Okay, all right. Yes, organ dysfunction or multi-organ failure. Okay, this is the first thing. All right, this is for my question. What are the criteria of sepsis? Any idea? How to diagnose sepsis? When can I say it is sepsis, not an infection? Can we say about for the second case that we've done with Dr. Umayma, is it sepsis? Can we say it is sepsis? The patient is confused. The patient is confused.
There are some clinical and some lab criteria.
Yes. Yeah. Okay. If you don't have the lab criteria, you stick to the clinical criteria. What are they? We are going to talk about them. High pulse rate, low blood pressure, tachypnea, unstable hemodynamics. Good. Well, okay. Yes. Okay. So, there are many criteria people can follow for sepsis. Okay, there's something called SOFA criteria, but here in UK, it's not well known. We use NICE guidelines, okay? And based on NICE guidelines, there is something called high risk sepsis criteria and moderate risk sepsis criteria, okay? We look for moderate risk because once you find out the moderate risk criteria, you can say it is sepsis. All right. What are these criteria? If the patient has 2 or more of the following. 2 or more of the following. What are the following, or what is the following? Respiratory rate more than 21. Heart rate more than 91. Let's say 90, but it's written 91. Blood pressure less than 100. Temperature more than 38 or less than 36. New confusion or confusion. Okay? If the patient has 2 or more of these, we can say sepsis. But again, If the patient is confused with high temperature, this doesn't mean it is sepsis because the vitals are normal. Okay? We can say sepsis if the patient is confused, high blood pressure, high temperature with a heart rate of 112 or blood pressure less than 100, then we can say sepsis. Okay? Because the elderly patient normally can get confusion from a simple infection. Okay? An infection raises the temperature. All right? So be minded of this. Yeah? So these are the criteria of sepsis, and we look for the moderate risk criteria, 2 or more of what I've mentioned. Yeah? You suspect sepsis. All right? From the news chart, if you have a news chart, usually we can say sepsis, usually if the news chart is 5 and above, the total news score. Okay? But we are talking now about the Simman and the monitor. All right? Any question before we move to the next 2 cases? Clear now?
Doctor, can I ask a question?
Yeah.
When the patient is confused, is it necessary to take a consent at the first of the assessment?
Consent from whom?
From the patient, from the confused patient. So I'm gonna examine you and may expose you.
Yes, you usually do this with all of the patients, either confused or not confused. If the patient is
Okay.
confused, this doesn't mean that you don't treat him as a human.
Yeah.
Okay? You will still
Okay,
need
thank
to
you.
tell the patient, Mr. X, I'm going to examine you now. I'll provide a chaperone with you, and I'm going to listen to your chest or whatever what you are going to do, even if the patient is confused. Okay? What is the difference? Thank you. Did I answer your question?
Yes.
Between this case and previous one. What is the difference between this case, the 2 cases? Both of them are hospital-acquired pneumonia. Both of them are hospital-acquired pneumonia, but the presentation is different. In the first one, the patient was not confused, and in the second one, the patient was confused. Okay? Yeah. Okay. Let's do the next one. We have Dr. Atusa and Dr. Sulaiman. Right?
Yes.
Okay. Let's do the case. Do I have to know what medication he takes for hypertension? Tell me. You answer me, Dr. Mahmoud. Do you need to know what is the medication that he takes for hypertension in this particular case? Yes or no?
They cannot cause acute illness.
Is it the patient's pressure, blood pressure is normal? Do you need to know what is the medication of the blood pressure? No need. In this particular case. In this particular case. Okay, what I mean by this particular case, I mean the case that we have talked about. In some cases, you will need to know. Okay? If he takes statin or something cause interaction. Okay, is it statin for hypertension? Statin is not for hypertension. Statin is for hyperlipidemia. The patient has hypertension only. Yeah. Okay.
Just one question, sorry. How can I get a good score in IBS when the patient is confused? So,
Okay. You will still treat the patient as a normal patient, not confused. You tell him, hello, Mr. X, do you know who am I? From the start, you tell him, hello, how are you, Mr. X? Are you okay? Are you feeling okay? If he tells you, I want my sister, you tell him, oh, okay. Mr. X, I'm one of the doctors here. My name is Sahar. Can you tell me your name, please? Can you tell me your name? Where am I? Okay. Mr. X, you seems to be confused. I'm going to ask you some silly questions. Can you answer me, please? Okay. Do you know where you are? Do you know where you are? I want my sister. Or whatever he says. Okay. Or maybe he answers some of the questions and the others no. All right. You will know that the patient is confused. If they want to show you or to tell you that the patient is confused, they are going to give you the non-verbal clue or the verbal clues to show the patient is confused. Okay? So this is how to deal.
okay.
Right?
Okay, thank you.
All right. Did I answer the question?
Yes, thank you. Thank you so
Okay.
much.
All right. All right. So let's do the next case, doctors.
Begin.
Off you go.
Hello, examiner. I'm Atusa Busuria. My GMC number 123. May I proceed?
Yeah.
Hello. Hello, can you hear me?
Hello, doctor.
Hello, I'm I'm Atusa, one of the doctors here. May I confirm your full name and age?
Yes, doctor. I am Adam Thompson and I'm 75 years old.
Thank you, Adam. I can see you're not feeling well. Can you tell me what happened to you?
I don't know, doctor. I'm feeling unwell. I'm not myself. I don't know what's going on.
Since when you are feeling unwell?
Since yesterday, doctor.
And what do you mean by that?
I don't know. I feel tenderness and pain down below, and I'm feeling unwell as well, doctor.
Okay, I do my best. You are in good hands. No, don't worry. Just can I ask you, do you have any other conditions?
I've done a procedure on my prostate 3 days ago.
3 days ago, and okay.
Yeah, yes. And yes, it went well, doctor, and I'm having a catheter as well. But I don't know what happened after that.
Are you on any medication?
No, just antibiotic.
Okay, thank you. Are you allergic to anything?
No, doctor.
Okay. Mr. Thompson, can you tell me if you had fever at home?
I'm feeling hot. I don't know. I didn't measure my temperature.
Okay. Do you feel any chest pain, any cough?
No.
Okay. Thank you, Mr. Thompson. I do my best, and I will assist you now. But I need to examine, checking your parts of your body and make tapping. And I need to expose some parts, and I will have a chaperone with me, and I ensure your privacy. Is that okay?
Okay, doctor.
Thank you, Mr. Thompson. So I can see my patient is attached to the monitor. and I assume I have taken all universal precautions. Okay, as Mr. Thompson can talk to me, I assume his airway isn't, and his oxygenation is okay. So I'm going to assess chest. Mr. Thompson, I'm exposing your chest to look at
Okay.
your chest. Any
Inspection is normal.
okay, and I'm going to listen to your chest.
Okay.
Any findings? Okay, okay. I can see your chest is noisy, Mr. Thompson. So let me continue my assessment by looking at your heart and circulation. I can see my patient's blood pressure is a bit low, and his pulse rate is a bit high. Let me feel a pulse. Okay, and I can see
Rapid
a
pulse.
monitor.
Rapid, equally, bilaterally pulse.
And your rhythm is okay, and I want to check the capillary refill of my patient.
2 seconds.
1, 2. Okay,
2
okay.
seconds.
I need. Okay, thank you. I need to insert a cannula to you. It will be some needles to your arm, Mr. Thompson. Is that okay?
Okay, doctor.
I insert a needle into your arm. I insert 2 large bore cannulas to my patient's arms, and I take blood from him to assess his full blood count, routine blood test, kidney function, urine and urine and urea and electrolytes, and also inflammation markers for him. And after that, I need a full lead ECG from my patient, an ABG, and a chest X-ray because it was noisy. So I
Okay.
start him on with 500 milliliter for in 15 liter.
Okay, take the fluid. Take the fluid from the drawer, doctor, and then put it.
Here.
How much
Okay,
fluid? Over how much
500
time?
500 milliliter of Hartmann solution or normal saline in 15 minutes first, and I will continue challenge till 1 liter in first hour.
Okay.
Okay, so now I'm going to the next part. I want to listen to your heart, Mr. Thompson. Any murmur in the
2
heart?
minutes
Yeah.
remaining.
Heart sounds is normal.
Okay, and now I'm going to depart. I want to shine light eyes. The pupils are okay.
Okay.
So, and the blood sugar by a glucometer, that would be pricking your finger, Mr. Thompson. Okay.
Okay. 4
Okay,
millimole.
and I can see 2 millimole.
4.
4.
4.
Okay, that's normal. Okay, and I need to check the temperature of my patient on the monitor.
39.
Okay, as you are feverish, I put you on paracetamol through your vein. How are you feeling, Mr. Thompson? Are you feeling any better?
No, doctor.
Okay, okay, I'm here to continue. I can patient blood pressure is better, but his heart rate is still high, so I'm going to E-part. I'm gonna expose your tummy. Any
Okay.
tenderness? Do you feel
No,
any pain, Mr. Thompson?
No, doctor.
Okay.
What are you going to check
Okay.
in the tummy?
Any rash, any, and also the tenderness?
Okay, no rash, no problem in the abdomen.
Okay, I'm gonna expose your legs to see if there is any edema, rash, or
Assume it's
pain.
normal.
And I want to check your private part. I can see the catheter is here.
The
Any
catheter
smelly or
is, Yeah, the catheter is
Elodie?
draining, no problem in the catheter.
Okay, there's no problem in the catheter. Mr. Thompson, when did you take this catheter?
Yesterday.
Okay, okay, that's okay. So,
Move on
Mr.
to the
Thompson,
next station.
Time is up. All right. Thank you, Dr. Atusa. All right.
thank you.
So, how do you feel?
I may cut off some unimportant things. Maybe I am explaining much. I don't know why I am short of time.
And why do you think that you were short of time? What are
Maybe
the...
one of them is talking to the patient at one time and explaining to examiner again what I'm doing.
Mhm.
Is it necessary for each of the things I am doing? Maybe it's not.
Well, what I can say is that did you practice Simman before?
Yes.
Okay. How many times?
Like 10 times or less than 10
Okay.
times.
All right. What I can see that you're doing the steps systematically, which is good. Okay. But the
Thank you.
problem is that you are doing the steps not quickly. You are slow in doing the steps, okay?
Begin.
Or you think about the next step, maybe. I'm not sure what's going on, what was going on in your mind, but you do the steps slowly a bit, okay?
Was there a pause between my actions?
No pauses, but maybe because you are talking, you are a slowly speaker. That's why,
Yes, yes.
maybe because of that, okay? So what I would say in your case, Dr. Atusa, because you're slowly speaker one, you can try to cut down or select the things or the points that you want to mention, okay? If you feel that talking to the patient and the examiner will take time from you, okay? Just tell the patient, okay, I'm going to take some bloods from you, all right? Yeah. And don't talk to the don't tell, I want to take blah, 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 blah. No, I will order blah, 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 blah. Okay, quickly, all right?
Okay, okay, yes.
Don't talk again. Don't tell, I will take the bloods to order blah, 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 all right? You don't have time to do that, all right? So be quick, select the words that you use. Yeah, this is a thing. The second point is about taking the history. You told me what do you mean by feeling unwell, which was good. And since when you are feeling unwell, did anything happen before having this problem? And then you asked about what? Medications and medical conditions, okay? And allergies, all right? So it was good, yeah? But the problem is that you are taking some time to ask, okay? Just, you have to practice on just ask the questions quickly, all right? This is the only thing that I would comment on your performance in taking the history and doing the steps. In terms of your assessment was systematic, okay? You've checked the airway. I would advise also when you examine the patient, you ask the patient, Mr. X, I'm going to examine you. I will provide a chaperone with me and I will ensure your privacy. Quickly.
Just that, yes.
Okay? Modify the words that you are going to say based on your pace of talking. Okay.
Mhm.
Yes, it would be better if you tell him, Mr. X, I'm going to examine you, I'm going to tab and listen and blah and blah. But
Mhm.
with your case, because you are a slowly speaker, you have to modify the way you deal.
Yeah.
All right? Okay?
Yeah.
Yeah. In breathing, you inspected and auscultated the chest. Okay? You didn't
Mhm.
palpate or percuss the chest. All right, this is not
Mhm.
a very big mistake, okay?
Mhm.
But it would be better if you do the percussion and auscultation as well, all right? If you don't do them, at least you've done the auscultation, okay?
Mhm.
Yeah,
Yes.
you asked for OBG and X-ray, circulation was good, 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 ECG and cannula. You missed something in the investigation, was really, really important.
Mm.
In acutely unwell patient. What is it, doctors?
In investigating
I think it
ABG.
will be included in ABG. It will be included
It
in
will.
ABG. But it would be better to
Lactate.
highlight it by name. Lactate.
Lactate. Yes. Yeah. Yeah.
Yeah? Lactate.
Yes.
Okay?
Okay.
You give me 500 milligram. My blood pressure was low, so you give me 500 milligram over. Well, you can say 1 liter over 15 minutes. Because you give him bolus, his blood pressure is low, not very, not not within the normal limits. So you can give him 1 liter over 15 minutes, or 500 over 15. It's okay, but always the bolus is 1 liter over 15 minutes. Okay. In D, all of the points were done. Exposure, temperature, Tommy, and catheter. Leg, you don't need to mention leg here. Do you need?
Yes. After I go spontaneously to the
Yeah.
I
Yeah.
remember that it was
So
not
I would
necessary.
advise in your case, Dr. Tusa, just
Mhm.
select the points that will help you
Mhm.
the most. Okay?
Yes.
Avoid wasting of your time because you didn't
Okay.
reach the management.
Unfortunately.
2 minutes
You didn't
remaining.
reach the management. Okay, you didn't tell me
Yeah.
that it is sepsis. You didn't give me antibiotic.
Yes.
All right.
Maybe after checking the temperature, I can verbalize antibiotics.
Well, you can do something here after the circulation. After the circulation, you can start talking with the patient.
Okay.
And then verbalize that I will complete my examination by assessment of disability and exposure. Okay. So this is another tip you can do if you feel like you are running out of time. Because in exposure and in disability, especially disability, exposure is important because you need to examine the wound and check the catheter. Okay? You can verbalize. I would ideally check the blood glucose and the pupil reaction for the patient. Okay, I'm going now to expose you. I'm going to check if the catheter and the wound site. Be specific.
Yes.
All right. Don't do every step. Okay. Pick up the points that are important in the case for you. Yeah. Okay.
Yes.
So a catheter and wound, just to check if the source of infection, the catheter or the wound,
Move
or
on
only
to
the
the
chest.
next station.
Okay.
But in that case, the sputum was the
Yes, sputum
source.
culture.
Mm.
You will do all of the cultures: urine culture, sputum culture, and blood culture. It's
Mhm.
sepsis. It is sepsis, right?
Mhm,
The
yes.
patient fulfilled all of the criteria
Criteria,
of
yes.
sepsis. The heart rate was above 100. The oxygen saturation, not the oxygen, the respiratory rate was 24. I think more than 21. Blood pressure is less than 100. Temperatures more than 38. All of these are fulfilling sepsis criteria. This is
Mhm.
sepsis. Okay.
Mhm.
All right.
I have another question about the breathing sounds. When I hear some sounds between crackle and roll, I cannot differentiate. So I will still wait in the heart failure and maybe sepsis or a chest infection.
Crackles and
Roll. Another name of roll would be
crepitation.
it would be, yes, crepitations by
Okay,
heart.
well, in both of the cases, you can hear abnormal sound, crepitation or crackles. Both of them can be present in pneumonia and in heart failure. Okay, how to differentiate?
Okay.
It's from the presentation. The patient is unwell, temperature is high. This is infection, okay? But in heart failure, the patient will present with shortness of breath since few days, and it's increasing now. This shortness of breath is increasing with exertion.
Yes.
You know, so it's the presentation is different. Okay.
Yes, the patient told me that I feel hot and
Yeah.
I wait for monitor. Sorry.
Yeah. Yeah. Okay. So this is the thing. The other thing is that he had a surgery before, so
Yes.
it's highly suspicious of infection.
Mhm.
All right.
I just
Okay.
asked this thing because of emboli, ruling out of emboli.
Yes, but he doesn't have shortness of breath or
Breath.
low saturation or
Yes.
anything represents PE. Okay.
Yes.
Yeah. So assessment was okay. The management, you didn't reach the
Oh,
management.
yes.
Yeah. In the management, you will say it's sepsis. It could be the sepsis could be due to an infection of the chest
Chest.
or the
Or
urine or the
urine.
wound. But here in this case, the case here, chest. Most probably it's from the chest. The urine is clear, the catheter is draining, the wound is clear from your examination. So most probably it's from pneumonia or chest infection. If you say infection here, without saying sepsis, your marks in the management will be very low. Okay? The treatment will be admitting the patient, keep monitoring, and take 3 and give 3. What are the 3 that you take and what are the 3 that you give? And you will tell the patient this. You can say, we will take 3 and give 3 medications for you, and we will take 3 investigations for from you. Or when you talk to the examiner, I'm going to follow the sepsis 6 protocol, take 3 and give 3. What to take and what to give?
Blood, urine, and IBG. and the management will take, we give antibiotics, oxygen, and fluids to the patient.
Okay, I'm happy with the giving. Okay, so you give oxygen, fluids, and antibiotics. What to take?
Blood, urine, ABG, a scan,
Cultures. Okay,
cultures, yes.
cultures, blood, sputum, and cultures. All of the cultures that you know. All right.
Yes.
Lactate.
Oh yeah, I forgot lactate always.
Lactate,
Yeah.
cultures, and urine, especially urine output.
Yeah.
Okay. All right. This is what you do in sepsis. Take 3 and give 3. All right. You can also tell the patient, we are going to keep monitoring your lactate. If it's improving, so your infection is improving. If no improvement, we will need to escalate the treatment after that. All right?
Oh,
Okay. All right. Yeah. Okay. Thank you, Dr. Atusa.
thank you so much.
Thank you, darling. So for your marks, I would say, oh, sorry. Data gathering, 3. Interpersonal skills, I don't think that they are going to give you 3 in the interpersonal skills. Your management, you didn't tell me the management.
Yes, the most interpersonal skills in management. I wish I do not repeat it in exam.
Yeah, it might be between 0 and 1, to be honest, the management. Between
Yes,
0 and 1.
yes.
Okay. Interpersonal skills too. Because of the whole assessment, not because your interpersonal skills is not good. Okay. Yeah, good, Dr. Atusa. Keep
Thank you
practicing.
so much.
And what I would advise you is just focus on your time management, what you need to take to select, just to cut down the data gathering and the assessment, cut down everything. Okay, modify your way in dealing. If you feel that doing all of the assessment will affect the time management, you can take off one of the points of the assessment if you feel that it is not important. Okay, you can verbalize D. All right, verbalize. Don't skip it. Verbalize that you're going to check, but for the purpose of the exam, I'm going to move on to exam check the catheter, the wound, to check if there's any source of infection. Okay. Yeah. All right. Let's do the next one.
Hello.
Hello, Dr. Suleiman.
Okay.
Ready?
Yes, I was trying to arrange.
Okay.
Sorry, I couldn't see my screen.
I can see you.
Yeah, you can see me.
Yes, I can see you.
Because I couldn't see myself, I couldn't arrange the view of the.
Well, okay. Do you have a problem now, or I'm not sure.
Yes, is it okay? My view right now.
Yes, your view is okay.
Okay, then I couldn't see myself. If the
No worries.
view is okay,
We can see you. At
Okay.
least we can see you.
I don't know where do you see exactly because of that. I'm worried.
Okay, no worries. Yes, yes. Okay, good. All right. Can you see my screen?
Yes.
Okay. Sorry, I will stop sharing just to prepare the monitor. Okay. and then we can
Okay.
start.
Begin.
Hello. My name is Süleyman Kaya. My GMC number is XYZ. I can see that my patient is monitored, and I can see that my patient is attached to monitor. May I proceed?
Yeah.
Thank you. So, hello, I'm Dr. Kaya, one of the doctors here. I understand you've been brought to hospital by your wife, and you were not feeling unwell. So, before starting, may I ask you, can you please confirm your full name for me?
Yes, doctor. I'm Adam Thompson, and I'm 75 years old.
And thank you. What can I call you?
Adam is fine, doctor.
Nice to meet you, Adam. Adam, so can you please tell me with your own words, what happened exactly?
I don't know, doctor. I'm feeling unwell. I'm not feeling good, doctor. Please
And
help me.
thank you, Adam. But can you please explain? Can you please tell me what do you mean exactly with feeling unwell?
I'm not feeling myself, doctor. I'm feeling lethargic and feel pain as well in down below.
Okay, Adam. And what do you mean exactly with the down below? Is it your back
I
passage?
don't know. I had a surgery on my prostate 3 days ago,
Or,
and maybe this is because of the surgery. I don't know, doctor.
okay, Adam. Thank you for sharing with me, Adam. So, how did it start? Did it start suddenly?
Yeah, yesterday. Yeah.
Okay, Adam. And Adam, do you have any medical condition?
No, I don't have.
Okay, Adam. And what was the surgery exactly? What did they do?
I don't know, doctor. I'm not sure what did they do. I don't know.
Okay, Adam. Adam, do you have any allergy to anything?
No.
Okay, Adam. So, Adam, now I would like to examine you. I will examine various parts of your body, and for the purpose of my examination, I will be checking, exposing various parts of your body. I will have a chaperone, and I will protect your privacy. May I proceed?
Okay, doctor. Yeah.
Thank you, Adam. So, Adam, now I can see that you are able to talk, so your airway is correct, but I see that your oxygen levels are a bit low. So, I would like to give 100% oxygen with non-breathable mask, 15 liters per minute. Is that okay?
Okay, doctor.
I see
Okay.
there is no swelling around your mouth, no foreign object in your mouth. Now I'm giving oxygen. And now, Adam, I would like to check your neck. Now
Okay.
I will expose your chest. Thank you.
Mhm.
And I will be touching your chest.
Okay. Normal inspection.
I will be tapping.
No, assume it's normal, doctor.
Thank you. And now I will listen with a specific experiment your lungs, and also I will listen your heart sounds.
Okay, the lung sound is here.
Thank you for the heart sounds.
Normal.
Thank you. So Adam, I will order an X-ray. So I will order ECG and arterial blood gas analysis. Then now I would like to pinch to your hands. Okay. For
Okay.
capillary.
The caprifill is 2 seconds.
Thank you. And now, Adam, also I would like to check your blood pressure. Your blood pressure
It's 90. It's 90. 90.
Okay, your blood pressure is also a bit in the lower side. So I will insert 2 large cannula to both of your arms, and I will send blood. I will send blood tests, 2 blood count, inflammatory markers, and also I will send some heart markers. And now I will start. I will put it in your vessel, and one will be sent in 30 minutes. And then so I would like to check your eyes. Okay.
That?
Now I would like to check your eyes with a light.
Okay.
I will
Normal bilateral. Reactive.
Can you please raise your hands?
Yeah.
Can you please raise your right leg?
Yes.
Can you please raise your left leg?
Yes,
So Adam, now I would like to check your blood glucose levels also.
it's 5,
And I will check your temperature.
39,
Sorry, 39.
39.
So Adam, so I see that also your temperature is high. So I would like to send a blood culture to the laboratory to see if there is anything wrong. And also I will now I will examine your private parts to check what if there is problem.
The ABG of the patient is here, doctor.
Thank you for letting me examine you, Adam. Also, I see that your blood is a little bit acidic, and also your oxygen levels normal, and your also your lactate levels a bit increased. So also you have a temporary running temperature. It seems like you have a condition called sepsis. Do you know what is sepsis?
No, doctor, what is that?
Adam, sepsis means the infection in your blood causes severe systemic infection. I mean, your
2
body
minutes
immune
remaining.
system reacting to that, so you feel this. You feel like this unwell. So it's an urgent stage. It's an urgent and urgent situation. I would like to start treatment as quick as possible. For that, I would like to keep you admitted to hospital. I will involve my seniors, and also I will give you antibiotic, broad spectrum antibiotics. And after the
Okay.
culture results arrive, after the culture results, we can change your antibiotic according to the causative organism. Is that okay for you?
Okay, doctor. Okay.
So Adam, now I see that you have a catheter. Also, I would like to change your catheter, and I would like to send a urine culture. And while you are admitted to hospital, and you will, I will send a blood sputum culture to the laboratory to detect the origin of this infection. Is that okay?
Okay, doctor.
So
So what do you think the infection is from, doctor?
when I examine your lungs sound a little bit harsh. I mean, it's an abnormal. It could be because of the infection. You were admitted. It could be caused by hospital, and also you are undergoing a surgery. So it could be because of surgeries complication or blood. Also, your catheter is a risk factor for this infection. So after the result, we will be more sure about that.
Okay, doctor. Okay.
Until now, is there anything unclear you would like me to explain further?
No, thank you, doctor.
Thank you, Adam. So if you have any concern or question or feeling unwell, please push the button. We will be here immediately.
Okay, thank you.
Thank you.
All right. Thank you, Dr. Suleiman. So, how do you feel about your performance?
I don't know. Maybe I'm not good at interpersonal skills mostly. So you can assess better.
Okay, no worries. Okay, so let's talk about the case from the start to the end. In terms of identification of the patient's identity, you've done it in addition to the WABAM. Okay, you've done it. You explored what happened exactly. What do you mean by feeling unwell? And do you have any allergies, any medical conditions? Okay. You can ask also some questions about systemic review if you would like. If you feel that it will take time from you, it's fine. You are going to assess the patient. Okay. Why it's not working? Yeah. Okay. Then you moved on to the assessment. You assess the airway and the breathing. I would like if you just don't use the term I will touch your chest. I will feel. Okay? I will feel your chest. Yeah. And, then you've asked for ABGs and X-rays, and you've given me oxygen. Well done. You could have asked me about if I do have lung conditions or smoker's cough, but it's better to ask any lung conditions just to find out the oxygen saturation that you are going to give to the patient. Is it high flow oxygen or low flow oxygen? Yeah. Circulation. You've assessed the circulation properly apart from asking for lactate and ECG.
Yes, in Simman, I did notice that I've written until now. In Simman notes, it was written that routine routine order ECG, chest X-ray, and ABG after completing the B part.
Did you do it? Did you ask for it?
Yes, I said
Okay.
after the completing the B.
Maybe because maybe I didn't hear it. Okay. No
Before
worries.
starting the C part.
Okay, no worries. No. Okay. Okay. You've mentioned it, so it's good. Lactate.
In arterial blood gas analysis, and
Highlight.
normally we see lactate, but also again we need to mention about it.
Yeah, I've mentioned that lactate. It will be in the ABG, but highlight lactate. Okay. Yeah. Then D, you've done it. And then you missed E, exposure, because I showed you the ABG. Then you missed checking the exposure. You didn't check the catheter or the abdomen or the wound. Right?
Yes. After looking the results, I missed that part.
You missed it, yeah.
Yes.
Yeah. Just be minded of this, okay? Yeah, and then you told me it's sepsis, and then the management. Well, you've told me the management, you know, all of the management, but not in a systematic way. Okay. You could have told me, well, you told me it's we will admit you and we will keep monitoring you, and then you talked about the investigations. The investigations were not systematic. I mean, you can tell him we are after admitting and keep monitoring you, we are going to take some or to investigate more for what could be the infection and where exactly the infection. Okay, for that we will take some bloods, as I mentioned before, the bloods that we have taken, in addition to some cultures. Yeah, for your blood and for urine and sputum or phlegm. Okay. What did you mention also? Lactate as well. You told him lactate in the management, or I can't remember what did you say exactly. But I'm going to tell you how to tell organized. Okay. So we will take some bloods in terms of in addition to what we have taken from you, we will take some blood cultures and phlegm and urine culture. Okay. We would also need to check your urine output. Okay. And keep monitoring you and keep monitor your lactate. That's it. Okay.
Yes. Thank you, Doctor. Yes, management organization is important.
Organization of thoughts. Okay. So the problem was the organization of thoughts. Admission, monitoring, investigations. If you didn't mention the treatment in terms of IV antibiotic, you can mention it in the management, but you've mentioned it in during the assessment, I think.
Okay.
Yeah. Okay.
I mean,
so,
the antibiotic part after. I mean, in the I will keep until the management part about antibiotic or treatment. You are offering. Yeah, you are suggesting. Wait until the management part about antibiotic or any treatment.
No. I didn't suggest that.
Okay.
I said I mentioned if you didn't mention during the assessment, you can mention it in the management.
Okay, thank you.
Yeah.
Mhm.
Okay. All right. Let's talk about the assessment. Yeah. Data gathering, I would give 2, because you didn't check the other possibilities of infection, the wound and the catheter. Okay. Management skills 3, interpersonal skills 2. Why? You need some organization of thoughts.
Yeah. And do you have any suggestion for me about interpersonal skills? What could be my weak areas, or what can work on it?
Well, here in Simman, the interpersonal skills will be when you take a consent from the patient while you're uncovering him. When you talk to the patient about the diagnosis, use a simple words, tell him you might have something called sepsis. This is an infection of the organs of the blood. It could be serious, but the good thing that we have detected now and you came in, don't worry, you are in safe hands. Just give him some supportive words. Okay. Do you have any concerns? Ask him, do you have any concerns before I talk about the management, Mr. X? Okay. And then after that, when you tell him, we will need to admit you, do you have any problem in the admission? Okay. Then you can, after that, after organization of your thoughts in terms of the management, you ask the patient, well, would you like me to call one of your family, or would you like me to update your wife about the condition? Yeah. So this is how to use your interpersonal skills in the case. You didn't use this, okay? But your interpersonal skills were not very, very harsh in this case. The only thing that I pointed to in this particular case is, when you talked with me as a patient, I was a bit, didn't get what you want exactly, the organization of thoughts. Sometimes the disorganization of thoughts will affect the interpersonal skills. Okay?
Okay.
You can practice with me in the other mocks, inshallah, and I can pick more about your interpersonal skills in terms of the other cases or other possibilities of the cases. Okay?
Thank you, doctor. Thank you so much.
Thank you, Dr.
Suleyman.
Yeah. Okay. Well, before we move to the next point, which is an important point for everyone here in Simman, because you might have ABG in the Simman, and I know most of you has a problem in reading ABG. Okay, so I'm going to teach you how to read the arterial blood gases, how to differentiate between respiratory and metabolic, and compensated or not compensated, and this piece of puzzle. Do we give oxygen in shortness of breath for a few weeks? Dr. C, I don't know your name, but what do you mean by, do we give oxygen in shortness of breath for a few weeks? If the oxygen saturation is normal, you don't need to give oxygen. Oxygen is a medication, okay? You don't give any medication unless it is indicated, all right? You supply oxygen to the patient if the oxygen saturation is less than 49. Sorry, 94. Okay, 94. 94 and above, you don't give oxygen to the patient. Okay, all right. We are dealing with acutely unwell patient. Acutely unwell patient. We don't deal with the patients who are going to die in advanced life support. In advanced life support world, we tend to give oxygen anyway. Okay, once we feel the patient is not feeling well, we give oxygen. Okay, because most probably the patient will die. All right. But in PLAB 2 and in the real life, we don't give oxygen unless it is indicated. Okay. I am an advanced life support provider. So maybe you asked this question because of this. All right. Yeah. So before we move to your questions, I want to teach you how to read ABG. In ABG, usually you will have the arterial blood gases in addition to calcium, sodium, potassium levels, in addition to lactate. All right? Sodium and calcium and potassium level are fine to understand below a level or above the level. It's easy to understand, in addition to lactate as well. If the lactate is higher than 2, so we can say it is lactic acidosis, and we find out why the lactate is high, what is the cause of lactate, and we treat it. Okay, but in ABG, you have to interpret the levels and to know, is it metabolic acidosis, metabolic alkalosis, respiratory acidosis or respiratory alkalosis, and is it compensated or not compensated, and what is this piece of puzzle? Okay, how to solve this piece of puzzle? Well, in any ABG, we look at 3 main levels, and we bear in mind 3 main points. Okay, 3 main levels and 3 main points. The first level is the pH. What is the pH? The pH is how acidic or alkaline the blood is. Okay, the strength of acidity and alkalinity in the blood. Okay, this is the pH. The PCO2, which is the partial pressure of carbon dioxide. It is the pressure of the carbon dioxide in a mixture of gases. We have mixture of gases in our blood, oxygen and carbon dioxide. So the partial pressure of carbon dioxide is the PCO2, and then the HCO3, which is bicarbonate. Okay, you look at these 3 main levels to interpret, is it metabolic or respiratory acidosis or alkalosis? Okay? Okay. What are the main 3 points that you bear in mind while you're interpreting? The first one is that the pH is between 7.35 and 7.45. If it is less than 7.35, the blood will be acidic. Okay? If it's more than 7.45, the blood will be basic or alkaline, alkalosis, acidosis, alkalosis. Okay? This is the first one. The second point is that PCO2 or CO2 is an acidic gas. the more you have CO2 in your blood, the more your blood will be acidotic. Okay? Once you find the CO2 is high in the blood, higher than this level, the blood will be acidic. Okay? The last point, HCO3 is basic. Okay? The more you have HCO3 in your blood, the more your blood will be basic, alkaline. Okay? This is acidic, this is alkaline. Okay? PCO2 always is related to the lung. Sorry for the lung. Okay? And HCO3 is always related to the kidneys or to the metabolism. Okay? All right? Lung, kidney. Yeah. Okay. There is another thing. Reverse is respiratory. Reverse R is R. What does that mean? Reverse is respiratory. Always bear that in your mind just to read the ABG quickly. Reverse is respiratory. What does that mean? If the pH is going down and the CO2 and the HCO3 going up, it's reverse. They are going in different directions. The pH and PCO2 and HCO3, both of them are going to different direction from the pH. This means most probably respiratory. Either respiratory acidosis or respiratory alkalosis. Okay? All right. If they are going, all of them, on the same side, so the pH is acidotic and the CO2 and HCO3 are going lower, all of them are going low, so this is metabolic what? Acidosis. The pH is acidotic. Metabolic, because all of them are going into the same direction. Okay? R is R, reverse is respiratory. If the pH is going to one side and CO2 and HCO3 going to the opposite side, this is respiratory. If the pH is going to one side and both of CO2 and HCO3 on the same side of pH, it is metabolic acidosis or alkalosis. Okay? All right? So acidosis or alkalosis is from the pH. Lower than 7.435 is acidotic. More than 7.45 is alkalosis. Okay? Acidosis or alkalosis. Is it respiratory or metabolic? R is R. Reverse is respiratory. Okay? Is it compensated or not compensated? Well, what is the meaning of compensation? What is the meaning of compensation?
Yeah, for example, if the patient has respiratory acidosis, that means the pH is low and carbon dioxide is high. So the carbon dioxide. So the bicarbonate start to treat or to correct.
How to know that this metabolic acidosis or alkalosis or respiratory acidosis or alkalosis is compensated from where?
from
From
for
the
me from
pH.
bicarbonate.
The
From
pH will be normal.
the pH. From the pH. Compensation means that they are playing together to neutralize the pH. The PCO2 and HCO3. Okay? If you find that the PCO2 and HCO3 are all not in their places, but the pH is within the normal limit or at the acidic side or at the basic side, but within the normal limit, this is compensation. This is compensation. But if you find all of them are all over the place, this is uncompensated. Okay? All right?
Yeah, okay. Okay, thank you.
Okay. If you want to know more why the reverse is the respiratory and all of them are metabolic, I can explain to you quickly. Okay? I just tried to give you this tips just to read the ABG quickly in the SIMMAN, okay? Or in any case. But let's say that let me clear all of these. Yeah. Yeah, okay. So, in the pH, if the pH is lower than the normal limit, which is 7.35, it is acidotic or alkalotic? Acidosis or alkalosis?
Acidosis.
Acidosis. Okay? All right. And CO2 is acidotic or alkalotic? CO2 is acidic gas or alkalotic?
Acidosis.
Acidic. Acidic. So the pH here in acidic, okay, and the PCO2 biologic to move the pH to the acidic side, the CO2 will be
High.
more than 45.
Yeah.
Okay. So this is how the acidity comes from the respiratory. From the respiratory system, okay? Usually the problem, if it's respiratory, usually the problem will come from the respiration, okay? So usually the CO2 will be high. Yeah, because it is acidic. The renal function or the renal system will try to compensate for that. What is the renal system will do?
Elevate the bicarbonate.
Increase the bicarbonate. So in respiratory, you will find that both CO2 and HCO3 are increasing and they are in the opposite side of the pH. That's why it is respiratory. And in alkalosis, vice versa, if the CO2 is less than normal, this means that the blood will be alkaline.
Yeah.
Alkalosis, because the CO2 is acidic. The less CO2 you have in the blood, the more alkaline your blood will be. Okay? So the pH will be alkalosis because of the low CO2. And the kidney, what the kidney will do to compensate for that?
Decrease bicarbonate production.
Decrease the bicarbonate. Right? Because bicarbonate is alkaline. She will decrease the alkalinity. Okay? That's why respiratory is the reverse. Got it? Got it? Clear for respiration? For respiratory? Yes or
Yes.
no?
Yes.
Okay. Metabolic. Let's say metabolic means the problem is coming from the kidney, from the metabolism, not from the respiration. Okay? So the problem will start from the HCO3. Okay? If the pH, if let's say that the HCO3 is above 26, what does that mean? Is it acidosis or alkalosis?
Alkalosis.
Acidosis or alkalosis?
Alkalosis.
Alkalosis. The pH will be on that side. Okay? Alkalosis. And the respiration to compensate that. What does the respiration do to compensate for that? Increase the CO2 or decrease the CO2?
Increase.
It will increase.
Increase. As you can see, all of them are in the same direction for metabolic alkalosis and vice versa. Okay? Got it? So is it acidosis or alkalosis? From the pH. Is it metabolic or respiratory? Or is the reverse? You look at pH, CO2, and HCO3. If you find they are opposite to each other, so it is most probably respiratory. Okay? Is it compensated or not compensated? From the pH. Okay? Is it compensated or not compensated? From the pH. If the pH is within the normal range, it is compensated. Not compensated, the pH will not be within the normal range. Okay? In the future, we can have a kind of, exercise on reading the AVG, but this is not our scope. I just wanted to, teach you how to read the AVG in the exam and for your life as well. Okay? Okay. Any question?
Yes, yeah, just
Yes,
want
I will leave the questions for 5 more minutes, okay? And I'll try to answer in this 5 minutes. Yes, who is talking?
Safa.
Yes, Dr. Safa.
Just I want to ask in the exam, so I can found this compensation or all the cases is acute case, so there is no compensation.
You are not going, you don't need to find out is it compensated or not compensated. You just need to check is it metabolic or respiratory, and that's it. And to be honest, from the presentation, the patient has shortness of breath. What will be the
Respiratory alkalosis.
alkalosis? He's washing CO2, washing CO2. So the CO2, which is acidic in the blood, is low. So the blood will be alkaline. Okay?
That's good. Yeah, thank you.
Yeah, no worries. pH is normal, but not CO2, HCO3. Yes, okay, Dr. Mahmoud Sulaiman. All right. Any other question? No questions? All right, good. So I hope that you now know how to differentiate between sepsis and infection. One of the doctors asked me yesterday, I think, about sepsis. Is it when the patient's blood pressure is lower than 100? Is it isolated low blood pressure? Well, again, this is not very right. Yes, in the criteria of sepsis in NICE guidelines, they said 2 or more of moderate criteria in a, or low blood pressure, okay? But if we think about it, let's say that the patient has come with only low blood pressure. Low blood pressure can be caused by many causes, not only sepsis. Okay? But if the patient feeling unwell with high temperature and low blood pressure, then it is 2 of the criteria. So we can say sepsis. Okay? Got it, doctors?
Yeah,
Yeah?
yes. Yes, yeah.
Yeah, okay. All right. So, yes, inshallah, I will share the timetable of the next month, inshallah, on the groups. It will be the same, skills mastering, mixed mock, and practical mock, inshallah. If you have any suggestion, please do write down. If you didn't manage to write down in the poll, please write down in the groups. If you feel that the session is helpful, please encourage your colleagues to attend. Yeah, see you inshallah in the next mock, inshallah. Dr. Saad, what the medical criteria? What do you mean by the medical criteria, Dr. Saad? Septicemia? Septicemia, infection in the blood, okay? Infection, all right? So it's not related to sepsis, affection of the organs, okay? Septicemia, the patient will be unwell, feeling lethargic, a high temperature, not feeling well, but the blood pressure is not very low. The heart rate is not very high, above than 110. So the infection, it's a infection, but you know, a bit complex than a local infection. Okay, but it is not sepsis. Okay. Dr. iPhone, the next mock, I'm going to share the time. Okay, I didn't decide the days because it's based on my shifts and my work in the NHS. I'm going to share the timetable or the schedule with you, inshallah, in the groups. Okay. All right, doctors. Thank you so much for attending, for listening, and yeah, hopefully it was helpful. And all the best, inshallah. Thank you. Thank you.